What are the risks of cataract surgery? Well, modern cataract surgery is a very low risk operation in most patients. The main serious complication remains infection, and this normally develops symptoms 1 or 2 days after surgery. But with modern techniques, including giving antibiotic into the eye at the end of the operation, the risk of infection is now less than 1 in 2,000. Significant hemorrhage at the time of surgery has also reduced considerably since small incision cataract surgery has been developed. When the cataract is removed, the back surface of the original cataract, called the posterior capsule, is left behind. It is left behind for a very good reason, as it is this that supports the new plastic lens that is inserted at the time of the cataract operation. A complication of surgery occurs if this posterior capsule is torn or ruptured at the time of the operation. The overall national rate of this event occurring is around 2% of cases, but in experienced surgeons' hands it can be much less than this. Why is posterior capsule rupture a bad thing? It can range in severity from mild rupture, still allowing the selected lens to be inserted, to moderate rupture, where a different type of lens is inserted called a sulcus lens, which has to be placed in front of the remaining capsule rather than within the capsular bag, to severe rupture, where some of the cataract can fall to the back of the eye, and this may need a second operation to remove the cataract that has fallen towards the back of the eye. The posterior capsule also acts as a barrier to prevent clear jelly called vitreous that occupies the main eye cavity from coming to the front of the eye, and if the capsule is broken, it can come forward and this can pull on the retina, increasing the risk of tearing the retina and causing a retinal detachment. Sometimes, after cataract surgery, the vision is good for the first few weeks, but then goes cloudy without any associated pain in the eye. This may be due to a condition called Irving gas syndrome, where waterlogging occurs in the central part of the retina or macula several weeks after what was technically uncomplicated surgery and is due to leakage from blood vessels. It usually settles with a more prolonged course of drops and vision returns. There are some conditions that do increase the risk of cataract surgery. If you are short-sighted, the eye is bigger than a normal-sighted eye, and the tissue is thinned and stretched, which can sometimes increase the risk of retinal detachment. A very dense or white cataract has a slightly greater complication rate, and there are conditions that sometimes predispose to glaucoma called pseudoexfoliation syndrome, and this can weaken the guy ropes that hold the lens inside the eye in place and can sometimes cause complications. And if you do have this condition, it is often better to operate sooner rather than later. The intraocular lens strength is usually very accurately determined by the measurements performed before surgery, but sometimes a refractive surprise occurs when the eye still needs glasses for good distance vision, when the measurement was to try and produce a situation where the patient was going to be normal sighted with no glasses needed for distance. Previous corneal refractive surgery or LASIK surgery also increases the error in these measurements.